Hello, my name is Marzan Piri. We are going to look at theater nursing as a component of surgery. So, in today's discussion, we'll start with the definition of terms. So, under definition of terms, we have operating theater. So under operating theater, I was saying this is a room or department of a hospital in which surgical operations and diagnostic procedures are carried out. A room in a department, a room or department of a hospital in which surgical operations and diagnostic procedures are done. We also have operating suite. This comprises the operating room and the immediate auxiliary accommodation. By immediate auxiliary accommodation, we mean areas which are close adjacent to the operating theater, which are adjacent or close to operating theater. So the main objective of this is to impart knowledge so that you're able to offer comprehensive nursing care and to the patient in the operating room and the recovery room, and provide an environment in which surgery can be carried out. So under here, we're just trying to emphasize as to why, as a general registered nurse, it's important that you have knowledge in operating theater. It's important to have knowledge because you'll be dealing with patients who'll be going to theater, and you need to know how to take care of them. You need to know how to take care of them. Though it is a specialty area of study, as a nurse has to undergo a special training to be called an operating theater nurse. So we are saying we just want to give you some basic knowledge which you must have before you start working from theater. But if you are to become a theater nurse, you need to undergo 1 year training for you to be called a registered theater nurse. It aims to expose you to the basic techniques used in theater in the same specialty. So this subject is going to, this component is going to introduce you to the basic techniques which are used in theater, so that when you are allocated to work from theater, you don't look blank. You need to go out there, work and fit in the team, because you've learned theater nursing, you've been exposed to theater nursing, so you shouldn't say I didn't learn. So we continue with our definition of terms. Operation. This is an invasive modality of treatment where an incision is made into the body tissue for the purpose of repair or removal or entrance into the body cavity. So operation, was saying, is invasive modality treatment where an incision is made into the body. An incision is made on the body of someone, and in most cases for the purpose of repair or removal or entrance into the body cavity, you need to make an incision. So that's what it means by operation. Another definition of term is perioperative. This is the total surgical experience which includes pre, intra, and post-operative phases of patient care. In pre-operative care, we mean this is care that is being given before the patient goes to theater. And under intra care, we mean the care that is given while the surgery is in process. Then post-operative care, this is the care that is given to the patient after surgery, and it is part of the care that is given in the recovery room and up to the ward, even when the patient has been given it is also post-operative care. Surgery. This is a branch of medicine that deals with pre, intra, and post-operative care of the patient. So the three phases that I explained earlier on, pre, intra, and the postoperative phases of patient's care. This is where surgery is hiked on. So I'm saying it's a branch of surgery that deals with the preoperative care, which involves preparations of preparation of a patient before he goes to theater. Again, care of the patient that is given to theater when an operation is going on, and the care that is given to the patient when surgery has been done until discharge. Surgical intervention. This is a therapeutic process to restore or maintain health. This is a therapeutic process to restore or maintain health. Just like the interventions that we do medically. So under surgical interventions, these are surgical interventions like wound dressing, cleaning of the wound, um, uh, ensuring that the drums for cleaning of the wounds they are ready. These are part of surgical interventions. Anything that is related to surgery in relation to the care of the patient, we may describe them as the surgical intervention. Then team, this is a group of two or more persons who recognizes common objectives and coordinate their efforts to achieve them. So if you look at theater, this definition of team is very important. If you are to carry out an operation, you don't need a you don't need uh, people less than two. You don't need people less than two. You can only operate if you have people more than two. For for example, you have a surgeon, you have a scrub nurse, and you also have an anesthetist. These are three. A surgeon cannot operate alone. A theatre nurse cannot do the operation on his own. So they need a team, and that's why we're saying the two or more people who recognizes common objective and coordinate their efforts to achieve them. So this team, like for instance, when we talk of the anesthetist, the theatre nurse, the thetanist who happens to be the scrubness and the surgeon. These three people, including the porter, they coordinate together to ensure that the operation is carried out nicely. Then operating room nursing. This is identification of the physical, psychological, social, and spiritual needs of the patient and implementation of individualized program of nursing care. So if you look at operating room nursing, is uh, nursing care that is given to the patient who is undergoing surgery. Even if surgery is in process, but as a nurse, you need to look at the patient who is undergoing surgery. You need to attend to his or her psychological needs. Like for instance, the operation is going on well, but a nurse, you need to look at the patient. If the patient is shivering, it could be the room is too cold. You need to maybe to adjust the air cons, which have been reduced to a very cold temperature. You also need to provide the patient with more bedding so that you can keep the patient warm. So all these, when you look at these are some of the nursing care that you can give to someone who is under an operation. We talk of vital signs, the BP, all those needs to be observed. And at times the patient may just be too nervous, especially when you've given spinal anesthesia. The patient may not be so comfortable. You can see that in the through body language. So you need to talk to the patient, make them comfortable, make them feel easy that they are in the safe hands. Let's now look at the theater environment. Theater environment. The first point under theater environment is design and construction. So we're saying this should preferably be on the first floor. It should not admit natural light and should have good ventilation system, separate from general traffic and air movement. Noise free and be close to the surgical boards, intensive care unit, ICU, casualty X-ray department, central stellar supply department, CSSD, and the laboratory. So we are saying the environment in which theater has to be constructed or made, it has to be preferably on the first floor. It should not be able to admit natural light. It should have good ventilation, separate from general traffic or air movement. It should be noise free. Noise can be uh, noise the uh, can distract the attention of the surgical team, including the patient, while undergoing the operation. We've also mentioned like theater has to be close to the surgical wards, intensive care unit, and these other departments because after an operation, if the patient needs intensive care nursing, the intensive nursing care unit has to be closer to theater. The patient has to be just moved from theater to intensive care units. Then the surgical wards, they don't need to move a long distance for them to transport the patient from the wards to theater. So theater has to be proximal to the laboratory, the X-ray department, the CSSD unit, as well as the laboratory, especially the laboratory is also one of the most important components. There are times you may need very urgent blood transfusion. You need to collect blood from the patient while the operation is going on. Someone has to rush to the laboratory. They do the urgent grouping and cross matching, get blood and bring it within a short period of time to theater. So you'd imagine if the laboratory is very far away from theater, that would also compromise the standards of care. The airflow must be free from the operating room to the entrance and no interchange between theater or other hospital areas. So theater is built in such a way that it has to be independent, away from other departments. Theater is not supposed to be exchanging any equipments with other departments. So this also is there uh, for the sake of uh, preventing contamination, cross infection. Theater is a very high hazardous area, so all the times we really need to ensure that theater is clean and all the utensils, equipments which are found in theater are clean enough to avoid infections. So the surface must be washable with joints between walls and the ceiling must be capped off. So this point is still taking us to the prevention of infection. Theater has to be washed in most cases, and it has to be painted with um, it has to be painted with oil paint, so that after some time, theater can be cleaned with a disinfectant. Can be cleaned with the disinfectant. The floors should be curved or round off to facilitate cleaning. The floor of theater is made with the terrazzo, and the mixer has to be very good so that all the times when the cleaning team comes to clean the floor, they don't have to face problems with the destruction of the floor. So the floor has to be well made with terrazzo. There should be no ceramic tiles, and the buffers must be used to protect the walls. In most cases, theater is made of heavy equipments and tiles are discouraged as heavy equipments may end up breaking the towels and making theater look dirty. Other consideration, there must be disposal area for used items, distraction, and recycling, what we call the dirty corridor. So in dirty corridor in theater, in most cases, we talk areas which are dirty where in most cases we keep dead things like tissues which have been removed during an operation, placentas, amputated legs, used swabs. We keep them in the dirty corridors, in most cases we call them sluice rooms, sluice rooms. Administration and teaching, catering, cleaning, the materials used in construction must allow for minimal maintenance. These I've already explained. So communication, there is no need for an effective communication system such as the intercom phones. There is need for an effective communication system such as the intercom phones. So in theater, there is need for good communication system. In other theaters where I've worked from, there is a bell that normally is used when someone wants to talk to someone. You just press it so someone from theater is going to come and attend to you. Someone is going to come and attend to you. Then thereafter, they'll go back and get what you want, or they may get you the person that you want to talk to. Okay, so that was the under environment of theater. So under environment of theater, we also have what we call access zones. There are 4 access zones in the operating theater department, and these includes general access zone. So this general access zone is a zone that can be accessed by anyone who goes into theater. A general access zone is a zone that can be accessed by anyone who goes into theater. For instance, if a nurse from the ward and the porter, they've carried a patient who is going for an operation, they'll stand before the red line. The area where they are standing from, that is an example of a general access zone. So that zone is being accessed by anyone who has gone into theater. Then another zone is limited access zone. Limited access zone. So under limited access zone, this is the zone which comes after the red line. This is the zone, excuse me, this is the zone that comes after the red line. It can be accessed by anyone who is in theater. It can be accessed by anyone who is in theater. The other third zone is restricted zone, restricted access zone. Restricted access zone. Under restricted access zone, this is an area which is accessed by people who are in the operation room. So I can give an example. In theater, you may have about 3 theaters: theater 1, theater 2, and theater 3. So when we say restricted access zone, we may mean one of the theaters which are there, like theater 1, that is a restricted access zone. For instance, if in theater 1 there's an operation which is going on, that area becomes a restricted zone because we don't just allow anyone to come in and go out, especially when a procedure which is being done there happens to be infected. It happens to be infected. We would restrict that everyone who is in that restricted zone shouldn't be moving out of that area. They have to move out of that area, change uh, uh, their theater gear and put on new clothes because that operation which was taking place in there was too bad. So that can be an example of a restricted zone. Then we also have what we call operating zone. Operating zone. Under operating zone, we are talking of a zone that is only accessed by 2 to 3 people. So under this operating zone, we are talking of a surgeon who is operating. We are talking of the assistant surgeon who is operating, as well as the scrub nurse. So these 3 people have access to this operating zone. No other person can access this zone, not even the anesthetist. So this is the most restricted zone of the 4 zones. The operating zone is the most restricted one. Then let us look at types of operating rooms. Let us look at types of operating rooms. We have what we call single theater suite and twin theater suite. We have what we call single theater suite and twin theater suite. So under single theater suite, we're just talking of operating theater which doesn't have many operating theaters. It's just a one room. But when you talk of twin theater suites, we're talking of theater which has other theaters inside, like this is theater 1, theater 2, theater 3. There are other theaters within it. Let us look at lighting and ventilation of the operating theater room. Lighting. The operating theater must not admit natural light as this causes glaring and forms of shadows. So just like I said in the beginning, we said theater is not supposed to admit natural light because this causes glaring and forming of shadows. We don't want uh, shadows on the operating zone because it prevents someone from seeing clearly. So in theater, theater is designed in such a way that the lights which are used for an operation, they are mounted on the ceiling and arranged to even illumination. This light source must be dust-proof and easy to clean. So we have lights which have been designed specifically for operations, and they've been mounted to the ceiling board, and they are very easy to clean. Even if an artery splashes blood on it after an operation, these lights can be cleaned so that they can be ready to be used for the next patient. Types of theater lighting. We have what we call mount reflector luminaire. We have what we call mount reflector luminaire. Under mount reflector luminaire, we have 2 types of lighting. There's what we call cyclic. We have what we call cyclic. This type of lighting has an optical lens with a single lamp of 100 to 150 watts. So under this cyclic, it's a type of lighting that is used in theater where there is only one bulb, but this one bulb, it has high voltage, about 100 to 150 watts. So this bulb is capable to provide enough light when they are doing an operation. Then we also have what we call metallic reflector light fitting. Has metal reflectors which are heavily polished. So this one we're saying it is type of lighting uh, which has the mental reflectors which are heavily polished. So when you compare this one and the other one, this one is a metallic reflector, whereas the other one is just a single lamp. Then the other second type is the mount lamp luminaire. The other second one is mount lamp luminaire. This type of lighting has 6 to 9 separate lamps. Each lamp is about 40 watts and placed in single housing unit. So under mount lamp luminaire, it's just like the cyclic type one, but the only difference is that in a cyclic type, there is one bulb with a high voltage, about 100 to 150 watts. But in mount lamp luminaire, it's a one lamp. It's a one lamp, but inside it has several bulbs. It has several bulbs. So these several bulbs which are found inside the one lamp, it has a small voltage capacity, like 40, 50, 60. So you find that if you start adding these 40, 40, you may you may have about 5 to 6 of them. like 100 and 150 watts. If you divide 150 watts by 40, you may find that you may have 4 to 6 bulbs in one lamp. So instead of having one bulb like Mount Leaf reflector luminaire under Mount Lamp luminaire, the high voltage watts, they are just distributed to other bulbs so that each bulb can have few voltage that can contribute to the one lamp. Let us look at ventilation. Theater should not admit free circulating air, no windows pressed. Therefore, there is need for good ventilation system that will minimize infection and provide comfort for both the staff and the patient. So the ventilation in theater has to be controlled. It has to be good to prevent infections for both the member of staff as well as the patients. Temperature in operating theater should range between 20 to 22 degrees. 20 to 22 degrees, and the humidity should range between 50 to 55. So let's look at types of ventilation system. Let's look at types of ventilation system. We have what we call plenum ventilation system. Plenum ventilation system. This system is fitted on roof of the building, sucks air from the environment and purifies it, humidifies it, heats or cools the air, and pushes the air at high pressure through its diffusers. Highest pressure is in the operating room and lowest in the dirty corridor. So from this explanation, you can see that the ventilation system which is installed in theater is there to help also prevent infection. If you look at the operating system where the operating room where the operations are being done, the pressure is high to ensure that there is no dirty air which is left in the operating system. And as you go to the dirty corridors with dirty environment, the pressure becomes low because this area is already dirty. Then the second type of ventilation system is ultra cleaning ventilation system. This is an advanced system used in vascular and transplant surgery, reduces postoperative infection by 0.6%. So if you compare the plenum ventilation system and ultra cleaning ventilation system, you may see that the ultra cleaning ventilation system is an advanced system which is mainly used in special surgeries, which includes transplantation surgeries. So in transplant surgeries, we require special ventilation system which can also contribute in the reduction of postoperative infection by 0.6% in this case, like we are told. So this pushes air through its diffusers at high velocity, covering operating theater area of about 2.8 square meters. It is 90% efficient. It is 90% efficient. Let's look at theater hazards and preventions. Theater hazards and preventions. We have gas pollution and explosion. In theater, we have oxygen cylinders. We have oxygen cylinders, and we need to take care of them. It can be a source of hazard, especially when people start smoking when they are closer to these. Or if they happen to fall down, they can explode. We also have diathermy machine. The diathermy machine, it bends if you don't know how to use it. So it can also be a source of burns. So we need to prevent by ensuring that these machines are kept properly. We also have what we call needle stick injury and unsatisfactory disposal of sharps. So needle stick injury in theater is real. It's very real and it's more common. You cannot compare it with the other words because in theater you deal with the sharp instruments. So you really need to practice and uh, take into consideration that needle stick injury in theater is real, and you need to prevent it by practicing a good disposal of sharp instruments. Wound infections. Wound infections, if we are to prevent wound infection postoperatively in the wards, the aseptic techniques has to start in theater by ensuring that the area where we are operating from, they are clean enough. We are using sterile equipments, sterile gauze, forceps, everything that has to be used on an operation that are sterile. Also what we call electrical sparks. Electrical sparks can be real in theater if our our electrical circuits are not well handled. So we need to ensure and report all naked cables, all naked cables to the workshop department to come and work on them so that we prevent electrical sparks. Technological advances, the use of monitors, we need to be advanced to learn to know how to use these monitors, because we need to monitor the vital signs of our patients by the use of these modern equipments. Also, faulty designs like what we've specified, how theater has to be designed. If there's no proper ventilation, no good floors made of tellers, or they're not there, theater might have been constructed in an professional way, and this may lead to a lot of damages, exposing patients to a number of infections. Also, absence of signs. In theater, we need to put signs so that people are able to be oriented to the environment, like where we can find some fire extinguishers, the sign of the danger sign of um, oxygen cylinders, no smoking. All those should help people to be oriented to theater, and just to prevent some few hazardous things that can happen from theater. So, under prevention of infection, cleaning of theater by day, dusting, major and minor cleaning. Theater has to be dusting on every day basis. Then we also need to allocate a special day where uh, members of staff from theater, they can just come and clean theater on a big day where they don't have operations. Then clean all articles before sterilizing them. It's true. All instruments, before they have to be sterilized, you need to clean them, make them dry, pack them, and take them for sterilization. Have acceptable preparation and packing method that allows articles to be delivered in a sterile manner. All articles which have been cleaned, dried, packed, sent to the CSSD department for sterilization, they have to be taken back to theater in a manner that won't break the chain of sterility. Wrapped articles must be packed standard. After instruments they've been packed, they need to be packed according to the nature of procedures, or uh, yes, nature of procedures, as whether gyne, orthopedic, general surgery, as well as the obstetrics. All these have to be packed in accordance to this area, so that we reduce inconveniences when someone has been sent to get any of the uh, packs which might be needed during an operation. Sterile persons must touch only sterile areas. When a patient is sterile, is only supposed to touch areas which are sterile as well. It is for this reason, in my previous explanation, I said there is operating zone which is only accessed by 2 or 3 people who are sterile. That is the surgeon, the assistant surgeon, as well as the scrub nurse. These are the people who are stellar, and they cannot touch anything which is not stellar. Avoid leaning over stellar fields to prevent contamination. Do not touch areas below stellar field also to prevent uh, contamination. Keep your hands within sight and above the waist level as well to prevent contamination. Cover wet areas with stellar material uh, to prevent strike through. Persons with flu, cuts, and skin infections should not be allowed to scrub. We know that flu is infections. So if you have flu, upper respiratory tract infection, which flu is one of them, we shouldn't be allowed to scrub because uh, the surgeon may get the flu, the anesthetist may get the flu, or the operation may just end up being infected. Change of outside clothes uh, to operate to operating gear. When you're coming from home, before you go inside the theater, you need to change the clothes that you've come with from home. This is a requirement. You just need to change your clothes and leave them in the changing room. Outside, use outside use outside and inside the knives. So there are shoes which you can use outside and the shoes which you can use for inside. Otherwise, if you use the shoes for outside and you bring them inside, you may bring what we call cross infection. You'll be just promoting cross infection from the external environment to the interior environment of theater. Change gloves when punctured. When you've been punctured or you get punctured in the process of an operation, you may ask for gloves so that you change. Wear face masks to prevent infection. Minimize talking when you are doing an operation, also to maintain sterility and prevent infection. Cover operation site if any delay and the operating instruments. This is one of the fundamental principles when you're about to start an operation. When you're about to start an operation, ensure that everything is set. If the operation has to delay, cover the instrument which you're about to use. About to use. So this has to be taken into consideration all the times. Never open the stellar pack before an operation, but you need to ensure that all the instruments are to be open when you're ready for an operation. So the end of we've come to the end of today's presentation. When we come next time, we'll start from the sterilization process.